Okay, great. Thank you so much for inviting me. I really appreciate the time here. And what I'm going to be doing is describing a program that I developed. And by the way, it's from the University of Minnesota, not Australia. Australia was the university that did the first research on it. Um, and it's kind of interesting. When you look at Alzheimer's disease, it was discovered over 100 years ago by Dr. Alzheimer's. He had a 51-year-old patient who had some memory problems, and he had no idea, what to do, how to help her. And when she died, he did a post-mortem surgery on her brain, and he found the plaques and tangles that continue to be the markers of Alzheimer's disease. We were talking about COVID earlier and how, we've already discovered a vaccine for COVID. And this is over 100 years ago now, and there's no vaccine. There's no cure on the horizon. There's no medication that will significantly slow the progression of any of the irreversible dementias. And what bothered me was when I saw people with advanced Alzheimer's disease, I found that they were existing, not living. So we were keeping them changed and keeping them bathed and sometimes keeping them in their bed. We'd put them in front of a television set, and they just, as far as I was concerned, they were existing, not living. And for me to be living, you need to be lovingly touched. You need to be talked to, not about, oh, Joyce, well, I don't know. Did she seem to have a bad night? No, no, talking to me. Joyce, tell me, did you have a difficult time last night going to sleep? And you might even take your hands and put your head down as if you're going to sleep. And I believe that certainly people now need to be pain-free until the moment of death. And hopefully, if we know they're passing, that we have somebody with them so they're not dying alone. And I want quality of life until they take their last breath. And I hope you can see the smile on this woman's face. I just happened to be there with her as she was passing, and she loved cranberry juice. And so I gave her a sip of cranberry juice, and I cut the straw so she didn't have to have a lot of energy to suck the liquid. And look at the smile on her face. And she was like that and passed away very quickly after that. So what ended up happening was I graduated from high school. I was told I wasn't smart enough to go to college. So I got married and have babies. And then when all my kids were in school, I didn't know what to do. And I had a lot of foster children. So I thought, well, maybe I should be a social worker and I'll work with children. Except that all the jobs with children were taken, and the only one that was available for me was in a nursing home. And I thought, all right, I'll do this for, maybe 3 months. And here I am, some 40 years later. And by the way, I probably am the oldest person still speaking on your conference. I'm 84 years old and I still love what I do. And thanks to people like you invite me to participate in conferences. And thank goodness for Zoom, because I don't travel anymore. So here, when I first started, people were able to talk about their feelings, and you could really be a social worker. And then I realized that the majority of residents had memory problems, so counseling wasn't important, just wasn't working. But activities were. The residents really loved to be in activities. But when they got to the point where they couldn't sort things and they couldn't color and they couldn't catch a ball, they just wandered around and oftentimes they fell. Sometimes they would just fall asleep during the day. And of course, then they were awake at night and given sleeping medications. And the doctors and nurses were diagnosing them as they must have been depressed. And so they were giving a lot of medication. And there they are. As far as I'm concerned, that's living. That's existing, not living. And so this is a quote from Walter. Two roads diverged in a wood, and I took the one less traveled. And that has made all the difference. And that's exactly why I'm so thrilled to be here speaking with you. So I was looking for a job as a consultant, and I'd met a woman at a conference, and she asked if I could come and do some consulting. And this is in Bennington, Vermont, and it's a veterans home. And I walked in, and here's a man with a double PhD, and he was just sitting there doing nothing. And so I thought, let me give him something to do. So I gave him decks of cards. And I said, Walter, I really need help. You know, we're going to play cards tonight. And the cards got all mixed up. And so he sorted cards. And because he had memory loss, he did it every day and didn't say, oh, I did this yesterday. And as people were walking by Walter, they were saying, oh, good job. Thank you so much. So he was feeling as if, something was really important. And I developed a program called the Club because in this particular nursing home, they were all members of the military. So they were in an officers club or a non-commissioned officers club. And I developed this program called the Club, one activity after another. So there was no break and there was no time when they weren't doing anything. And I had some wonderful results from that. And I thought, okay, and look at this. Because we had them busy all the time, they went from 16 falls to 8 falls in Dublin, Georgia, when they started the club. And I thought, okay, great. It's a good time for me to retire. And again, this was 40 years ago. Um, and the administrator called me back and he said, Joyce, please come here because we now have residents that no matter how good the club is, they can't participate. And I realized that they had advanced Alzheimer's disease. And as far as I was concerned, they were existing. We were keeping them fed and changed and sitting on the outside of an activity. And here she is, existing, not living. And at this time, we were thankfully stopping CPR, tube feeding, and hospitalization. And this was a daughter whose mother was in the club, and her mother could no longer participate in the club. And she said, Joyce, she said, do you think you could develop something like the club for my mother? She can't participate in the club anymore, but could you do something for her? I really don't want to give up. And I didn't want to give up. So I thought, all right. So I need to develop a new program. And of course, a new program has to have a name. And I had no idea what to name this program. So I had the club and I read something that said namaste, to honor the spirit within. And you can't copyright the word namaste. It's like hi, hello. So I added care to it. And I hope you'll see that Namaste Care honors the person receiving it, the person offering it, the families. I get feedback from staff all over nursing homes and assisted living and hospitals saying, we're just so proud that we're doing something that no one else is. Now, I wanted to make sure that I didn't have so many rules and regulations that the staff would go, yuck, I don't want to do this. So I only have two principles. One is that it takes place in a calm, relaxing environment. So you try to make the space where you're holding this small group as home-like as possible. And, natural light, not ceiling light, which is so industrial. And, I've gone to um, used furniture stores and family members have brought furniture in and just made the room as nice as possible. And you can see we painted the room. It was, off-white, very institutional. We painted it light blue. We got some fabric and one of the family members made some drapes and we hung things on the wall, as you can see. And the loving touch approach. So nothing is done in a hurry. Everything is done with this loving touch approach. It is a group program, and we use it in the United States and in other countries in nursing homes or assisted living. However, I just came back from Hong Kong, and I went to a hospital where one whole floor was doing Namaste in a hospital. So wherever you can offer it, in Iceland, they're doing it a couple days a week in an adult day center. So however you can do it, just making sure that the two principles are available. And you can see big smiles on their face. You want to make sure that you know this person. And so here's Betty, and her family happened to be there the day that we had started Namaste. And I said, "Tell me a little bit about Betty. What did she enjoy doing?" And they said, "Well, once a week, she went out for lunch with her friends, and she always wore this blue hat and white gloves." And I said, "By any chance, do you still have the blue hat and white gloves?" And they said, "Yes, we can go home and get it." Well, Betty, when she was brought into the Namaste program, she just had this most sad face, no smiles at all. Well, we put the blue hat on her and the white gloves, and look at her. And everyone that came in would say, "Oh, Betty, I love your hat." And it just made a blue hat, made quality of life exceptional for Betty. And then I wanted to make sure that people were comfortable. So you can see this resident was very contractured. We use the pain as scale. And by the way, you can find this on the internet. My husband, Ladislav Volitzer, and his nurses at the Bedford VA hospital in Massachusetts developed this way to determine pain in people with advanced dementia who could no longer tell you, on a scale of 1 to 10, how much pain they were in. And then we get her comfortable, and we don't leave her until she looks like this. And everyone has their own blanket, which of course we keep in a plastic container so that we don't have to worry about infection control. But you can see she's all snuggled down and a big smile on her face. Nurses told me that a lot of people with advanced dementia have urinary tract infections because they don't drink enough. And the aides are so busy, they just don't have time to stop at everybody's table and make sure that they drink everything from breakfast, lunch, and dinner. And so what we do is, with nursing approval, when somebody comes in the room, we assess them for pain, and then we give them whatever is appropriate for them. And most of the time it's juice. In China, it's tea. And so you can see a big smile on her face as she's sucking away at her drinks. And when the families come in, we encourage them to be part of the program and to help mom or their daughter or whoever be drinking, so that they understand that that's significant. And we've significantly lowered the number of residents having urinary tract infections. And so here we go. And you can see, here was a resident that all day long, "I want to go home. I want to go home. I want to go home." And the nurses and the aides did everything to try to soothe her. They even tried medication to see if they could stop this anxiety. Nothing worked. And they brought her into the Namaste room when I was there. And I was like, "Oh my goodness, we can't have somebody yelling, 'I want to go home.'" So with the nurse's permission, I gave her a lollipop. And she just sucked on that lollipop and rarely said, "I want to go home," and eventually just became part of the Namaste program. And here's a man who loved, his family said he loved oranges. So we would get a whole orange and cut it in fours, and he would suck away on it with this beautiful smile on his face. And in the morning, what we end up doing is we wash their faces and wash their hands, but we do it with this loving touch approach. And you can see, here's Janet, just saying what beautiful skin you have. And I want you to notice her name tag. Now, the company and the state or the country wants you to wear a name badge with your first name, your last name, and maybe your staff physician, and maybe the logo of the nursing home or wherever you're working. And you wear that. But also, she's got one so that a resident can read it and call her by name. And she decided, Janet, whatever they want to be called is fine with us. And then we use Pond's cold cream because that is something that, at least in the United States, and as I'm traveling internationally, I found that Pond's cold cream is oftentimes used all over the world. But whatever is with a favorite. And here's a resident who I showed the Pond's to, and she was nonverbal. And she looked at Pond's and she said, "Oh, Pond's, I've used it my entire life, or I'd look like a prune now." And I never thought about using face cream on a man. And absolutely, I learned so much from the staff. And she took some unscented oil and she massaged a man's face that was also dry. And what she ended up doing was using allspice. And that's a very common aftershave lotion. So she just put a little drop in it. But whatever, again, is culturally appropriate, put in that and make sure that you massage the gentleman's face as well as the ladies. And fussing with their hair. There's probably not anything that I do that provides more smiles than just fussing with their hair. And here was a resident that the family said, was talking about, tell me about, what she did in the morning. I think her name was Sarah. And tell me her, the ritual. And they said, well, as soon as she got up in the morning, she put on her lipstick. That was very important. And of course, the staff wasn't putting lipstick on her. They didn't have time. So I asked the family if they would bring in the lipstick. We put it in a plastic bag so we didn't have any problem with um, any infections. And she got her she got her lipstick on. A little surprised. And in the morning program, here's a man that had a dog his whole life, and here he is. He's brushing the dog, and I'm so sorry you can't see me because my dog is right here, and I usually take Covey up so that he gets to greet everybody. But and we make sure to tell the staff and inform the families that we're going to use this to help him be soothed, that it's not a toy, that is a therapeutic tool that we're using that brings pleasure to a resident. And here was a woman that had 6 children, and all day long she was just rocking back and forth with empty arms. And again, with the family's permission, and educating the staff that this was not a doll. This was her baby, and she was going to, that we wanted to see if this would bring a smile to her face, and you can see that it did. It was funny, her husband came in that afternoon and he said to her, "Oh, I didn't think you had a baby last night. Congratulations. Is it a boy or a girl?" So everybody got a smile out of that. And then they don't go outside. And so we bring the outside inside. It's just too difficult to bring in a small group. You usually have 8 or 10 residents, and to bring them outside and get them back in is very difficult. So we bring the outside inside. And I happened to be there on a day when it snowed. And so the aide went out and she got snow, and the residents tried to make snowballs and lilacs. And one that was so funny, the aide's husband had cut the grass, and she got grass clippings and put them in a plastic bag. And so we brought them in. And when we put them under the nose of the ladies, they smiled. When we put them under the nose of the men, they kind of went, "No, no," like, "Oh my gosh, I have to go out and mow the lawn." And here was a resident who'd been a ballroom dancer. And I asked the family if they had a gown that would they mind bringing it in. And they said no, we kept it in a plastic bag. And every morning we put her gown on her, and you can see big smile on her face. And of course, everyone complimented her on her gown, and they had heard that she had been a wonderful ballroom dancer. So basically, that's what happens in the morning. And then the residents, the aides come in, and one by one, they're taken to their room and they're changed. They're all incontinent at this point. And they have lunch, and then they're taken back to the Namaste Care room in the afternoon. And welcome back. And as in the morning, when they first come in, they're all greeted in a very special way. Some get a hug, some get a handshake. Um, So glad you're here, something positive about them. We do the pain assessment and we continue to do the hydration. In the afternoon, we might do foot soaks. We might read books. And again, we do juices and the lollipops and anything soft. They love puddings. They love ice cream. And we don't worry about them not having an appetite for their meats and potatoes and all of that for dinner. We just want to make sure that they have something to eat, something to drink that's enjoyable for them, and that they do partake of whatever we're giving them. And so we've cut down on the weight loss significantly. And here's the resident, really happy. And in the afternoon, we play dance music and we're doing exercises, but we're doing it with this wonderful dance. Uh, as you can see, she's got her hand and she's, playing a lovely dance music on the intercom. And you can see in this particular situation, this resident's hand was all clenched up, and the nurses had such a hard time prying it open to clean it. And we did hand massage. And when we did hand massage, you can see the hands just opened and we were able to clean them without the hassle of, pulling them apart. And the nurses and the nursing assistants loved that. And they ended up doing that in the residence room and soaking their hands. Here's a hand massage. And we do it very gently, very gently. 3 times with everything, 3 times on the top of the palm, 3 times on each finger, each knuckle. And oftentimes the families or volunteers will come in and do hand massages. Very, very pleasurable activity for somebody with advanced Alzheimer's. And the men, of course, don't get an old-fashioned shave. The staff doesn't have time to do that. But once every day, one man gets an old-fashioned shave. And they love it. They love it. And that's when we use the allspice. And we use music. Here's a music therapist that came in. And here was a woman who didn't speak at all. And we played a song that was popular in the United States many years ago. How much is that doggy in the window? Woof, woof. And so he started to play it, and she started to sing, woof, woof. And the next thing you know, she was singing. And so we discovered that using music that they would remember, even if they can't speak, they can sing. And this is showing a daughter who has come in, and I happened to be there next to her. And I was giving hand massage to one of the residents, and she said, "Do you think I could give my mother a hand massage? She hasn't noticed me for several months now. She just stares at me. She doesn't know who I am." And so the daughter gave a hand massage, and the mother looked at her and said, "I love you." And here's a man whose wife, again, didn't recognize him at all, but he gave his wife a hand massage, and she looked at him with a big smile, some recognition for the first time in a long time. So you can see we had some wonderful results of reducing medication. And here we go. And pain ad scores went down. And the falls, we were just so amazed at what we were able to do with just this very simple program. I'm certainly not as research oriented or probably as smart as all of the other speakers. And this is what we had. And I wrote a book, and it's now in the 3rd edition, and it's in 9 countries. So, I'll just do this quickly. I was asked if I could put it in a bag and bring it to the bedside. And so we have hospices all over the world putting Namaste Care in a bag and bringing it to a resident's room, knocks on the door, she pulls the curtain. She wants to make sure that that scent, which we usually use is lavender, but whatever is culturally, seasonally appropriate. And then she sprays it, and she puts the music on. And of course, this is an old slide now. She uses her phone. She assesses her for pain. If there's any pain, she makes sure the nurses come in. She gives her water. She does the face, does her hair, does her hands, and then she says goodbye. And this is when someone is passing. We put a butterfly on their door so everyone knows that someone is passing in that room. And we try to make sure that no one dies alone. And we don't hide the body. We take the body out, and the staff, whoever wants to say goodbye, can say goodbye, offer a prayer. In this particular home, the resident had been there for many, many years. And I was there, so I stayed back with the residents, and the nursing supervisors stayed with the residents, and the staff, the kitchen staff, maintenance, everyone went out to say goodbye, said a little prayer, and waved goodbye. Thank you.